Welcome back to Midday. It's about 22 past the hour as we take a look at some medical coverage. Ebola is making headlines again as Denver health officials announced yesterday afternoon they have a patient in isolation who they were concerned was exposed to Ebola. They say the man recently traveled to the Congo and then returned to the U.S. just a couple days ago. CBS's Dylan Thomas reports on the test results.
Paramedics and hospital staff at Denver Health were dressed head to toe in protective suits Sunday as a possible case of Ebola made its way into the hospital. The patient, a Denver resident who just returned home from the Congo 2 days ago.
He reports being in the eastern part of the Congo. He became ill very suddenly early this morning.
The patient was admitted to Denver Health's biocontainment unit.
It is a very secured area. It is isolated from the rest of the hospital.
A room with specialized ventilation and staff specifically trained for cases like this.
We have the ability to give the patient care, but while protecting the rest of the hospital and our staff from potential exposure. All the evaluations so far and the testing have not supported a diagnosis of Ebola.
Dr. Connie Price says the victim's symptoms pointed in several directions.
Anything from the flu to appendicitis. These are very sort of vague symptoms.
But the patient will remain in isolation for the time being.
We can continue normal operations in the hospital while continuing to care for this patient.
Denver Health is one of 10 regional facilities designated by the U.S. Centers for Disease Control and Prevention to care for patients with Ebola.